I believe we're recording now.
Okay. All right. Good morning, everybody. So, for those who just joined, I am Claudio is pulled into budget talks as we try and wrap up the budget. So, I'm going to be sitting in as chair for today's meeting. And since we do have some members of the public, I thought it would be helpful if we just real quick start off by doing introductions. So I'm Melissa Morton. I'm a planning specialist here at the Office of Policy and Management, and I will kick it over to Heather.
Thank you, Melissa. I'm Heather Ferguson Hull. I also work at the Office of Policy and Management here in the Health and Human Services Policy and Planning Division, and I provide staff support to the Workforce Council. And I will pass it over to Fran.
Hi, I'm Fran Sinish. I live in Stratford and I'm on the Workforce Council. I'll throw it over to Eileen.
Good morning. I'm Eileen Healy. I'm the Executive Director of Independence Northwest in Naugatuck, one of the 5 independent living centers. Sorry, Adam.
Good morning. My name is Adam Prizio, and I am a senior staff attorney with the Office of the Healthcare Advocate. I will give it to Kathy.
Thanks, Adam. Kathy Flaherty, I'm the Executive Director of Connecticut Legal Rights Project, which provides legal services to people living with mental health conditions who are eligible for mental health services from the Department of Mental Health and Addiction Services. And I'm a governor's appointee to the Workforce Council. I will pass it to Denise.
Thank you, Kathy. Denise Palladino. I work for the Department of Developmental Services as the Self-Determination Director. And I'm also a member of the PCA Workforce Council, and I'll pass it over to Dawn Lambert.
Hi, everybody. Sorry I was a little bit late. Dawn Lambert. I co-lead the Committee Options Unit in Division of Health Services over at DSS. It's nice to be here. Joined late, so I don't know who's did Heidi go yet? I don't know. Who are we?
Just our Workforce Council we were doing first, Dawn.
Okay, sorry.
Nope, all good.
Can you punt for me? Or because I don't know who I'm punting to.
Yeah. I think everybody introduced themselves. So Heidi, if you just wanted to introduce yourself, that would be fine.
Sure. Hi, my name is Heidi Hanier. I'm a education consultant for Aging and Disability Services, the Bureau of Rehab Services. And one of my responsibilities is personal care assistance. Nice to see everybody.
Nice to see you, Heidi.
Melissa, I think Peg was just able to join again.
Okay. Hi, Peg. We were just doing introductions. If you just want to introduce yourself.
Hi, good morning. I'm Peg Shiguru-Szymanski, and I'm a retired person from the utility industry, and I am on the council volunteering to represent the consumer employers.
Great. Thank you.
Thank you.
Thanks, everybody. We have a pretty full agenda today, so we're going to jump right in so that we have time to enter executive session. First up, we have an update on the training fund committee. And so I'm going to pass it over to the fund committee co-chair, Dawn Lambert.
Hi, everybody. Pretty quick update. So we've been working pretty hard to get the initiatives that y'all approved probably 3 or 4 months ago up and running. All of them are up and running with the exception of the support and planning coach training, which leads to PCA credentialing to become a support and planning coach. And we're just walking through what the viable options might be available to Tufts that Tufts could make available for PCAs. PCAs could participate and get the certificate and then and use that certificate to indicate that they meet the credentialing requirements. So unfortunately, you know, we used to do it, and Melissa, as you know, ADS used to do person-centered planning, which we're not doing as much as we once did. And so with the state not actually sponsoring those things right now, we did turn to Cater, which is Boston University, just to see if they have any curriculum that would crosswalk to the learning objectives that are required as competencies. We didn't have 100% match, and so it's delayed the process just a little bit. But so anyway, there is a meeting this afternoon of the training fund, and I'm sure they'll be talking about that a little bit more. That's all. Back to you, Melissa.
Thanks. Anybody have any questions on training fund? No. Okay. So just to give a very, as you all know, we're in the process of trying to implement the collective bargaining agreement that was signed back in May of 2022. And that included some new provisions such as premium assistance, the provision of paid time off. We also increased funding to the training fund so they could do skills enhancement trainings and offer additional trainings. I think they're also looking at using some of the carryover from the prior year's contracts and some of the new funding from the existing contract to offer tuition reimbursement again. That was something that was offered under the original collective bargaining agreement, and they're looking to offer that again for PCAs. The wage increments have gone into effect on schedule. So wage increases, I think there was was there one on January 1st as well? I can't remember. Yeah. So that went into effect. That all happened on time. GWIs happened. So we're in good shape there. So I'm going to turn it over to Dawn and Denise to give just a brief update on where we are with the lump sum PTO and premium assistance implementation.
Denise, you want to take it?
Sure. In terms of the 6% lump sum, which was a employment look back period, I believe it was April 1st of 2021 to March 3rd, 2022. Arbitrary
31st,
dates, right? Yeah. That was paid out by both FIs. The date was January 9th of 2023. And just to kind of give some backstory on why the implementation of the current contract was a little delayed is because it was approved from CMS so late in the game. So the CBA conditions through DSS's SPA, which is their waiver amendment, was approved on December 16th, 2022. So as soon as we got the approval and green light, we started implementing the 3 conditions that hadn't, as Melissa said, been implemented. That first one was lump sum, 6% on the look back period of that full year of wages. The second piece to this is the healthcare premium assistance, which is providing PCAs and DSPs, direct support professionals, with funds that can be used to offset costs for getting insurance premiums. So using that money to purchase insurance on the Access Connecticut exchange. The FIs and the 2 state agencies that are helping to operationalize this are in the process of working on a plan. Folks have already been communicated, both the employer of record and the workforce, to contact the FIs who are going to help the state agencies implement the healthcare premium. The healthcare premium does have a few eligibility requirements. They need to have worked with a specific consumer employer for at least 6 months. They have to have applied for and found not eligible for Husky and Connect CT. As soon as they have that information, they can contact the FI and apply for the healthcare premium. We are working on the actual time frame. So what happens is the FI issues semi-annual payments There's only one application that's due per year. So every year, the consumer employer will work with their PCA or DSP to apply for that healthcare premium through the FI. So it's a one-time application per year, but the FI pays semi-annual payments based on the number of hours that the individual hours plus their wage, obviously. So their hourly rate plus their, and they get the healthcare premium based on that. It's 6% of their previous annual broken up into semi-annual payments. I know it sounds complicated, but that's the language of the CBA, up to 5,000. So there's a lot of different pieces and moving parts to this. Folks who have multiple employer of records will and can apply for the healthcare premium through each one of them individually. So let's say I was a PCA and I worked for John and I also worked for Mary. I worked, 20 hours for Mary and 10 hours for John. I could apply if I had worked 6 months for each one of them, and I've been denied for Husky and Connect CT. I can apply for each healthcare premium assistance under each consumer employer. So that's a wonderful option for folks who don't carry a 40-hour job. They can apply, like I said, for multiple benefits. What else do I want to say about this? Oh yeah, am I able to speak about the special enrollment period? Okay, so here's so that Workforce Council has been working with Access Health CT. So Access Health CT organizes and basically manages our the healthcare exchange, Connecticut Healthcare Exchange, where folks go on once a year, usually between November 1st and I think it's January 15th of the year for their enrollment periods to purchase a insurance plan and pay premiums. Because it's past January 15th, we didn't feel that it was fair for the PCAs and DSPs to get this healthcare premium assistance payment and not be able to apply it to our health benefits. That was the whole purpose, at least we thought, to get folks insured, right? So we've been working with Access Health, who is now going to be offering is it a 90-day or 60-day?
I believe
But
it's
we're
60
still
day.
working at, but we're
Okay.
still working out the specifics. Those aren't public yet, but we're
Okay.
definitely, we're offering a special enrollment period. Yep.
Beautiful. Excellent. Yeah, we're offering a special enrollment period. So the folks who can't, because we already missed the deadline of January 15th to be able to purchase a plan, we're working with them to have a special enrollment just for the PCA DSP workforce.
And DSS and DDS are working with the FIs and with Access Health to try and coordinate the distribution of the payment as best as we can with the special enrollment period so that folks get the funding and it aligns with the whatever the window is, if it's 60 days, 90 days, whatever the window ends up being for the special enrollment period, that it aligns with the distribution of the payment to try and minimize frustration so people can have the longest window possible to utilize their first premium assistance payment to purchase a plan. Access Health has been a really great partner. They also set up a designated phone line for PCAs that's going to have a message on it, welcoming them to Access Health CT that we will be able to promote when the time comes. So they're really going above and beyond to make sure they have dedicated staff to help with the special enrollment period and that there's a streamlined process for that the PCAs can use to obtain their denials for Covered Connecticut and Husky Health, and then also use the same number to enroll during the special enrollment period to get help from navigators to find the plan that's best for them. That's it. Is there anything? Dawn, did we miss anything?
Nope, that sounds good.
And then the last piece is
go ahead. Eileen has a question.
Sorry, I may have missed this, excuse me, but if using your example, Denise, You've got
Yep.
working 20 hours for one consumer and 10 hours for another consumer. What's the maximum benefit in that situation?
So the maximum benefit per each consumer employer would be 5,000.
So it's up to $10,000.
It could be up to, it's 5,000 per each consumer employer. So you have to look at it that way.
Over 12 months.
hmm
Okay.
So what happens is a lot of folks, you know, who are doing this type of work aren't always in a specific 20-hour, 40-hour schedule. It's flexible, right? So based on the 6-month look back period for the employee, let's say that they worked for Mary and Mary had a lot of, she would go away with her family in the summertime. So hours would be decreased during that 6-month look back period block. So the amount of hours would have been reduced for that 6-month period. So her premium health assistance would be based on those hours and it would be less than maybe the next semi-annual payment period because the hours are flexed, right? So as long as, I mean, 5,000 is the cap per person per year. So it would
Okay,
depend.
Yeah, it basically
That-
translates into if any PCA is working full-time for an employer, full-time, 40 hours, they will get the maximum benefit that it becomes pretty close to $5,000. That's what it translates into. So it kind of was based on full-time work, 6% of what they'd be earning with the full-time work. And that's the max benefit. If they're working overtime, then they're not going to end up over the course of 12 months, right? If over time, they're not going to. If they're working for more than one employer, if they're working 80 hours, which there are some that are, then they're going to pick up 10 grand. And frankly, if they're working more, if they're working for 3, you know, then of course they'd be potentially picking up. I don't know how they would do that, but I'm not saying no one is. I think it's certainly possible that we're going to have a handful that are picking up $10,000.
Yeah. I have a follow-up question too then. When you're talking about the look back and determining what that period is the FI going to be in a position to let the PCAs know that they're eligible?
No. Well, I mean, if the PCA applies, then they'll do it, but it's not a proactive. It's not an outreach where the FI is calling people or sending messages to say, hey, apply for this because you're eligible. They're not doing that.
So Eileen, to answer your question, so DSS and DDS. So we typically, and I shouldn't use we, but typically DSS and DDS speak to the consumer employers. And then there are instances where it's important that we also get messages out to the workforce as well. So I would say DSS, DDS, and 1199, and Dawn and Denise, correct me if I'm wrong, work together on correspondence that would go out to consumer employers. So consumer employers received information informing them that they should let their employees know that this benefit is coming and that they will should be able to avail themselves of that. 1199 has already started its own outreach and done blast text messages and other things to PCAs to let them know. And then once we have the dedicated phone line and we know the dates of the special enrollment period, we'll be communicating that with 1199 as well so that they can continue to do outreach to their membership. But it's an active application process where the PCA has to actually apply because they have to do a lot of steps before they can apply. They have to get a Husky denial, a covered Connecticut denial. That's all one process through Access Health. They screen you for both. And we're going to have to, educate around that whole process as well. So it's happening on both sides, trying to let consumer employers know and trying to let the PCAs know. Okay, is there anything else on the implementation of the current CBA before we move on? No? Thanks so much, Dawn and Denise, for the update. That was super helpful. So PCA registry update, I'm not really sure how much can be shared on this or where that stands. Maybe just a brief status update would be helpful.
So I can take it. We've incorporated, we did get some late input from another group. Thanks, I know you guys participated. The CFC advisory group participated. The SEIU PCAs participated, and we had some employer forums. We did just get the last input like 2 weeks ago, crosswalk. So it's in a very, very final stage right now. It hasn't been released yet, but all of the input has been incorporated in the document. So we're very, very close.
The council never saw, Heather never got a copy to just take a look at, but I know she signed the NDA, but never actually received it to look at. So that'd be great if she could just take a look before, just as an FYI. But that's good. All right, so that's going live soon. And then wait, so the CFC council looked at the RFP? What did the CFC council?
No one.
No,
looked at the
they looked,
RFP.
no, but they looked at the crosswalk is what you're saying, the crosswalk document?
They saw the crosswalk that was released years ago. Yeah. I mean,
Yeah.
everybody saw that. That was public then. It's public now. So
Great.
they saw that and had the opportunity to provide input over a couple of different meetings.
Okay. So the next thing that, does anybody have a question about the registry before we move on? Okay, so I'm actually going to, Heather and I are going to try and take the next one. We have a little bit of funding, not much, but a little bit, to do some consumer employer engagement. So to do mailings to consumer employers, we were hoping we were going to use it for a forum. But folks have still been feeling a little uncomfortable about doing a big in-person consumer employer forum. So what we were thinking is, as we enter collective bargaining, we certainly can't, unfortunately, share outside of the bargaining team anything that's being discussed, but we could start to poll members for what's important to them. What would they like to see the council do in the next round of negotiations? What are things that are important to them? What are some other ways we can start to keep consumer employers informed and engaged? Let them know about the council, what the council can do for them, what our role is. We just wanted to open up this segment of the meeting to all of you. Even if you don't have a thought now, if you take it back and get back to us on what we could do, we want to put this money to use before the end of the state fiscal year. So on June 30th. So think of ways that we can engage the consumer employer population. For those of you who are consumer employers or parents of consumer employers on the call, what would be helpful? What do you think that consumer employers need to know or would want us to know? This is really, we're looking to all of you to guide how we make the best use of this outreach funding. And Heather, is there anything you want to add that I might have missed?
No, I think you captured it very well. Thanks, Melissa.
Do people in a quiet group today? Everybody's sleepy. Could I ask that everyone take that back as some homework please, and think about it and get back to Heather and I. And we don't want to just randomly throw money. First of all, it's not a lot of money. I forget what it is, like $1,000, something like that, right, Heather? It's not 1,500. It's a small amount, but we want to use it wisely. Do we want to look at doing a another consumer employer forum in the spring? If so, we need to start planning now. Do you think we're ready to do an in-person consumer employer forum? We'd be happy to put something together if folks feel that we're ready for that. Would you rather use the money in another way? Are there other things that we could be doing to reach the population and engage our consumer employers, and make sure that they're informed and have a voice, can interact with the council? We're open to that as well. Yes, unfortunately, we can't do that, Kathy. Kathy had said, can we give gift cards? And unfortunately, the state we can't incentivize participation in focus groups. That's a really good idea. We asked about that a couple years ago, and we were told no, which is too bad. But what we can do is raffles and things at a forum to get people to come. It's kind of, we can work around it.
Because what's kind of amazing is, like, if the state hired a consultant to do the focus groups, the consultant would probably be allowed to do that, but it's just that the state can't do it directly.
Correct.
Okay. Thanks.
But do folks want to try an employer forum? Denise looks like she wants to cry, so I'm going to take that as a no.
Well,
I wouldn't want to
Melissa,
do it in person.
Oh, you wouldn't? You still wouldn't? Okay.
I personally would prefer not to.
Okay.
But honestly, though, I'm not a consumer employer. I think I would really want to know what consumer employers feel.
I think it's a good question to ask the consumer employers. Somehow do a reach out and ask them what they think.
So here's my question. How do we do that? Because the council can't reach the consumer employers, only the FIs can. So,
can FIs put something in their pay stubs, as a, respond to the survey, go to this website, respond to this question?
that's a good suggestion, Peg. A lot of folks unfortunately do direct deposit. I know that they do get, some of the folks do get, pay stubs mailed to them still. I think that timing is everything. Unfortunately, with us rolling out these last couple of conditions of the CBA, as well as the transition of FIs, because there was an RFP for new FIs. We have a bunch of rate changes that are happening. I just think it would be I wouldn't want to put extra workload on the FIs. If there's another way we can do it. I knew through DDS, our case managers have a direct involvement daily, if not with, consumer employers. That would be a great outreach. I don't know if Dawn would be able to tap into the area agencies on aging, through their CFC program, if there would be some kind of way that we can info share. We also have our PPL, which is public partnerships, and they provide training to our employers of record through DDS. We can tap into them as another resource to kind of, market this or get some information out to try to pull people. So there are other ways other than trying to, the FIs would be the easiest because they have all the addresses, they have the contacts, but we might need to kind of grassroot it a little bit just because the workload right now currently on the FIs. I would be concerned about that piece.
So I think what I hear though is really a good point from Peg, that instead of us trying to figure out
Mhm.
what do the consumers want to hear from us, we need to ask the consumers, what do they want? So Peg, why don't we take that back, Heather and I, and we can talk with Denise and Dawn and see what we can figure out creatively, and then work with all of you to make sure we're asking the right question when we do come up with the mechanism to reach folks. How do we want to phrase the ask and make sure that the group agrees that we're asking the right, maybe one or two quick questions that somebody can just get on a Survey Monkey and respond to.
Yeah, I agree. And I think that if you give them perhaps, 2 or 3 options and let them pick and keep it
Mhm.
simple so they don't have to come up with some
Yeah.
ideas themselves, that would be the easier the better, right?
Yep. That sounds fantastic. Great. Is there anything else on consumer engagement strategies? Because I realized I skipped an agenda item. I skipped the fiscal intermediary transition update. I don't know if that was subliminal or, but do we have anything else? And please, if you come up with other ideas in the meantime, shoot them to Heather. She's always there for you, and there's no bad idea. So, I think, the more creative, the better at this point. All right, so FI update. I know you can't say too much, Denise, and Dawn has us on hold, so I'm guessing she had to take another call or something. So I don't. The update might be, yep, we're transitioning, but I don't.
Yeah, so just so folks, I know you guys are aware that both DDS and DSS issued an RFP, which is a request for service proposal for a new fiscal intermediary or even intermediaries to take on the DDS self-direction and the DSS CFC self-directed programs to manage and to issue payroll to the workforce. At this point, there was the contract had been signed. There's some language stuff that needed to be revised. It's at the Attorney General's office, as I understand. We are looking at conservatively an April 1st, perhaps transition start timeframe. That doesn't mean they take over and everybody that they are assigned to or work with will be beginning April 1st. There's a rollout phase that we've worked with the new FI. So DDS folks, because we're 1/3 the size of DSS, will be going first in terms of the transition for them to take over the specific payroll obligations and all of those things. And we're also looking at transitioning the folks who are dual supported in terms of their funding allocation. So DSS, DDS, so it would be the CFC folks and the folks under DDS who self-direct. So those folks will be in the first phase, and then we're going to be working on a plan with DSS on how they would like to implement. I don't know if it's going to be, maybe I'll push that to Dawn. I don't know if it's been any further described, if you guys are doing it geographic, if you're doing it based on alphabet. I don't know like what the plan is going to be in terms of the phase for DSS, but we're not looking at this happening anytime in the near future for the full transition of the FI.
I needed to take another call, so I don't know what
based-
the question on the floor is.
Just an update on the new FI transition, and I basically said that, yeah, that we'd be going first, DDS, because we're smaller, and then we're going to phase in from there. That we're hoping the contract will be signed and we can begin the transition in April, but I said that's a conservative estimate.
That's a good summary.
Yeah, okay.
Thanks
But-
so much.
Just so everybody knows, the FI capabilities is well advanced than what I think folks are used to. So personally, I'm very excited when they do get started. Their technology is very advanced. They seem to have the resources in terms of both the staffing as well as the IT behind them. And they have the right philosophy, and they're showing a lot of success in all the other states that they work in. So I, for one, am really looking forward to when they start.
If there isn't anything else on the fiscal intermediary transition, is there anything else? Okay, is there any other business? Anybody have anything else they want to raise? Okay, at this time, we'll open it up for public comment. If any members from the public have a comment they want to make. Not to put you on the spot, Heidi, I think you're our only member of the public that I see on, so, but I know you're usually just here to observe, but wanted to give you an opportunity. Nope.
Okay, I'm okay. Thank you for asking.
Okay, great. All right, then at this time, I need a motion for us to adjourn and enter executive session.
So moved.
Okay, Kathy made a motion to enter
Second.
executive session. Second? Dawn, did you second or
Second.
were you coughing? Oh, Eileen, okay.
You can take either one.
All right, so with that, we're gonna enter executive session. Thanks so much for joining us, Heidi. Have a good week. Heather, can you